Did you know one of the most overlooked risks after 60 isn't just heart disease or diabetes, it's poor circulation? The tricky part is how quietly it builds. You can feel fine for years, until one day a stroke steals your balance, your words, or your independence. In the U.S., hundreds of thousands of people have a stroke every year, and a surprising number could be prevented with small, steady habits that support healthy blood flow. I'm not talking about gym memberships, boot camps, or learning a complicated routine. I'm talking about 40 seconds, less than a minute, of simple positions you can do on a couch, in bed, or standing by a wall. These are gentle, science-informed moves designed for real bodies over 60. Easy on the joints, friendly to stiff backs and tight shoulders, and powerful for the brain and heart. This video won't drown you in medical jargon. I'll keep it plain and practical. We'll walk through 6 easy positions, each one crafted to nudge circulation in the right direction, calm your nervous system, and give your heart a small but meaningful break. Think of them as tiny switches you can flip during your day, before a nap, while watching TV, or right before bed, to help oxygen reach your brain and reduce the silent strain that adds up over time. If you're someone who wants to stay sharp, independent, and steady on your feet, you're in the right place. Hit subscribe and tap the bell to join our Health Vita community. We share friendly, doable tips that respect your time and your body. And let's make this interactive. Drop a 1 in the comments if you're curious to try these, or 0 if you're skeptical and want to see proof first. Either way, you'll get clear steps you can try today. Ready to begin? Our first position takes seconds, needs no equipment, and helps your heart do its job with less effort. Let's start there. Note, these tips are educational and not a substitute for your clinician's advice. If you have specific medical conditions, check with your doctor first. Imagine you're settling in for a nap or calling it a night. Instead of lying flat on your back, roll gently onto your left side. That's it. No gadgets, no strain. This tiny shift can lighten your heart's workload and support brain circulation, especially after 60. Why the left side? Think of a major vein, the inferior vena cava, as a freeway running up the right side of your spine, carrying blood from your legs back to your heart. When you lie on your left, you take pressure off that freeway, so blood can merge and move more smoothly. Your heart gets a small break, and oxygen-rich blood can reach the brain with less resistance. You might wonder, does a position really matter? For many older adults, it does. Left side sleeping has been linked to calmer breathing at night, fewer interruptions from snoring or mild apnea, and overall better oxygen delivery while you rest. Think of it as giving your body a head start on recovery without adding one more thing to your to-do list. How to do it: under 1 minute, roll left with a slow exhale. Head and neck: use a pillow high enough to keep your neck in a straight line. No chin jammed to chest, no head tilting up. Hips and knees: place a pillow between your knees to align your hips and reduce back strain. Upper shoulder: hug a small pillow to keep your top shoulder from collapsing forward. This opens your chest for easier breathing. Breathe easy, take 4 to 6 relaxed nasal breaths, and notice your heart rate ease. Extra benefits people notice: calmer nights, less startle-awake episodes, more continuous sleep, steadier mornings, fewer head rush spells when you first stand up, quieter room. For some, less snoring, which your partner may thank you for. Quick tips and adjustments: shoulder sensitive: add a softer pillow or switch to a slightly forward fetal angle so your bottom shoulder isn't pinned. Acid reflux GERD: left side can help. Elevate the head of your bed 4 to 6 inches or use a wedge pillow. Hip discomfort: a thicker pillow between the knees or a folded towel keeps hips level. Back sleeper by habit: start left, and if you roll at night, just reset whenever you notice. Progress beats perfection. Safety note: if you have specific cardiac, pulmonary, or spine conditions or severe sleep apnea, Check with your clinician for personalized guidance. Tiny habit cue. When you turn off the lamp, say out loud, left and rest, then roll left. After a week, most folks do this automatically. Pair it with 40 seconds of slow breathing to double the benefit. Transition. Now that your heart's got a little help while you sleep, let's tackle a daytime fix you'll use constantly. How you sit so circulation doesn't get kinked like a garden hose. We sit a lot during the day, at meals, watching TV, reading, messaging. The issue is how you sit can make circulation flow, or kink the hose. The good news, you only need 40 seconds to straighten the flow. Core posture for adults 60 plus, feet flat on the floor, knees at 90 degrees, not tucked, not dangling. Back gently upright, shoulders relaxed, avoid stiff arching or hunching. Don't cross your legs for long. Crossing pinches veins and can cause numbness or ankle swelling. Hips back against the chair, add lumbar support, small pillow, rolled towel, screen, TV phone at eye level so your neck isn't bent down. The 40-second posture reset, fix the feet, uncross legs, plant both feet flat. Lift the breastbone slightly, as if a string lifts your chest, while dropping the shoulders. Gently press your lower back to the chair for 2 to 3 breaths. Feel the lumbar support. Tuck the chin slightly, don't tilt up. Eyes forward. Calf pump. Flex point your ankles 10 times, like pressing a pedal, then toe taps 10 times. This activates your calf second heart to push blood back to the heart. Easy memory cue, flat, straight breathe pump. Feet flat, back straight, calm breaths, calf pump. Why it matters. Proper sitting reduces pressure on arteries to veins, helping blood reach the brain and the legs more smoothly. Prevents pooling in the lower legs, risk of heaviness, swelling, and over time DVT. Helps keep blood pressure steadier by avoiding neck bend and belly compression. If you must sit long, movie, car, plane, every 30 minutes, heel raises, toe raises X20, ankle circles X10 each side. Shift pressure, loosen tight waistbands, change your sitting angle for 1 to 2 minutes. Small footrest, box, cushion, helps shorter folks keep feet flat. Sip water regularly, small sips, so vessels aren't thirsty. Safety note, if you have a history of blood clots, venous insufficiency, or chronic leg swelling, ask your clinician about compression stockings and a movement plan that fits you. Time to stand up and unlock the neck-shoulder area so blood can reach the brain more easily. All you need is a flat wall in 40 seconds. Goals: release age-related tightness in the neck and shoulders. Bring head-neck spine back into a neutral line, easing pressure on vessels that feed the brain. Build posture awareness so you keep better alignment even off the wall. How to do it? Step by step, 40 seconds. Stand near the wall. Heels wackus 1 inch from the wall. Knees soft. Touch 3 points to the wall: sacrum, upper back, baxillale enubi au unaus, back of head. If the head can't touch, hover close. Don't force the neck. Gentle chin tuck, 1 per 2 inch, and lift the breastbone slightly to open the chest. Drop the shoulders. Lightly press the lower back toward the wall for 2 to 3 slow nasal breaths, feeling lumbar support. Open the shoulders. Raise arms into a W shape, elbows touching, hiatus near the wall. Inhale 4 sec, exhale 6 sec for 20-30 seconds. Finish. Let arms relax. Step away 1 to 2 steps. Keep the sense of head tall, shoulders down, chest open. Breathing tip, a 4-6 rhythm. Inhale 4, exhale 6. Helps calm the nervous system and lets vessels relax. Optimizations for 60 plus, stiff neck, hard shoulders. Angle your body slightly. Place a thin towel behind the head. Just a soft touch, no forcing. Sensitive low back, slight knee bend, add a rolled towel behind the lumbar curve to keep natural alignment. Shoulders won't reach. Start with a lower arm position, an L, and raise a bit higher each day. Benefits you may feel: clearer head, brighter eyes a few minutes after practice, less neck-shoulder tightness from long sitting, naturally taller posture and deeper breathing while walking. Safety note: if you have severe cervical lumbar degeneration, acute neck pain, dizziness when looking up, or a stroke history, use the gentle version, head just close to the wall, and consult your clinician as needed. Quick memory cue: 3 points, tuck chin, open chest, slow breathe. Transition. With the neck shoulder area unlocked, let's return to sitting with a small foot elevation to take load off the leg veins and help blood return to the heart more smoothly. Segment 5 will show the smart 40-second leg elevation setup. When you're reading, watching TV, or eating, slightly elevating your feet helps blood return from the legs to the heart, easing heaviness, our swelling, and reducing venous pooling, especially helpful after 60. Quick setup, 5 steps, was 40 seconds. Pick a low rest, a small footstool, sturdy box, or thick cushion, about 2 to 4 inches high. Place the whole foot on the rest, not just heels or toes. Keep knees 90-100 degree. Sit back with support, shoulders relaxed, align hips, knees, ankles, avoid external rotation. Calf pump, flex point ankles 10x, then toe taps 10x, like tapping a drum, to activate your calf second heart. Breathe 4 to 6, inhale through the nose 4 sec, exhale 6 sec while holding the position, another 10 to 20 sec. Memory cue: low rest, feet flat, calf pump, slow breathe. When to use it: after dinner, while reading or watching TV, after long travel, car, plane, or long periods on your feet. Anytime you notice numbness, heaviness, or ankle swelling. Benefits you may feel: less pooling in the lower legs, reduced swelling, heaviness, easier heart work as the veins get a little help, warmer feet as circulation normalizes, optimizations and variations: shorter legs, high chair, add a small footrest so your feet stay flat, visible veins or frequent achiness. Ask your clinician about compression stockings, size and wear time. Sofa too soft? Add a small lumbar pillow so you don't sink and compress your abdomen, shirt vessels. Safety note: if you have a history of DVT, severe heart failure, sudden swelling, or unexplained calf pain, talk to your clinician before using leg elevation. Transition. With leg flow opened, let's layer in a breathing reset that calms the nervous system, improves oxygen delivery, and supports steady blood pressure. Segment 6, 40-second diaphragmatic breathing. When stress rises, blood vessels often tighten. Belly breathing nudges the body into rest and digest, gently relaxing vessels, easing the heart's workload, and helping oxygen reach the brain, especially valuable after 60. How to do it: 40 seconds in a chair or bed. Position: sit with back supported or lie on your back, relax shoulders. Hands: one on the chest, one on the belly, above the navel. Inhale 4 sec, nose. Feel the belly rise, belly hand lifts. Chest hand stays mostly still. Pause 1 sec, gentle, not a hard breath, hold. Exhale 6 sec, pursed lips. Slow, steady stream. Feel the belly fall. Repeat 5 or 6 cycles, 40-50 seconds. Tip: soften shoulders, jaw, tongue. Aim for a 360 degrees expansion around the belly rib cage. If the chest lifts more than the belly, dial back the volume and keep it quiet and smooth. Why it helps: lightens cardiac load, gently lowers heart rate, and may ease blood pressure, improves flow. Relaxed vessels carry blood to the brain more evenly. Better sleep calms the nervous system before bed. Fewer head rushes can support steadier positional blood pressure for some people. Best times before sleep/nap: 40 seconds is enough to downshift. After stress and anger, 1 to 2 minutes to vent pressure. Stack it. After wall posture or leg elevation for a compounding effect. Adjustments for 60 plus 4-6 rhythm feels hard? Try 3 to 5, inhale 3, exhale 5. GERD reflux, elevate head, upper torso a bit. COPD asthma, keep pursed lip exhale, avoid long breath holds. Lightheaded, pause, stabilize, sit, lie. Resume when comfortable. Safety note, educational only, not a substitute for medical care. If you feel chest pain, worsening shortness of breath, or dizziness, stop and contact your clinician. Quick cue, belly up, chest quiet, long exhale. This posture is deeply relaxing, yet very practical for circulation. All you need is a wall, lie on your back, and rest your legs straight up the wall. In about 40 seconds, gravity helps your veins return blood from the legs to the heart and brain more easily. How to do it? 5 steps, power 40-60 seconds. Set up. Use a flat wall. Lay a thin towel if you like. Get into position. Sit sideways, close to the wall, then roll onto your back and scoot hips near the base. Extend legs up so hips are neister, or any angle that feels comfortable. Arms and shoulders. Arms at your sides or on your belly. Relax shoulders. Keep the neck neutral. Breathe 4 to 6. Inhale through the nose 4 sec. Exhale 6 sec with pursed lips. Hold for 40-60 sec. New to it? 30-40 sec is fine. Exit safely. Bend knees. Slide feet down. Roll to your side for a few breaths before sitting up. Prevents lightheadedness. Comfort tip: if hamstrings feel tight, move hips 2 to 4 inches from the wall. If low back is fussy, place a thin pillow towel under the lumbar area. Benefits: you'll likely notice less pooling in the lower legs, lighter calves, ankles after a long day. Easier venous return, the heart works less, the brain gets oxygen more readily, downshifts the nervous system, great pre-bed calm. Some people find digestion feels easier when done 1 to 2 hours after dinner. Optimizations for 60 plus back pelvis discomfort. Use a more open hip angle, hips farther from the wall. Blood pressure swings or dizziness on standing. Always roll to your side 3 to 5 breaths before getting up. Visible varicose veins. Ask your clinician about session length and daytime use of compression stockings. Safety note: avoid if you've had recent eye surgery, glaucoma, or if your clinician advises against leg elevation for specific heart-lung conditions. If you feel numbness or pain, come out right away. Quick cue: at wall. Relax shoulders, slow breathe, exit gently. You now have 6 gentle positions that each take about 40 seconds. They're simple, joint-friendly, and designed for real life after 60. The secret isn't doing them all at once. It's layering 1 or 2 at the moments you already have, when you wake up, before a meal, during TV time, or as you wind down for sleep. Morning, clear head start, 1 to 2 minutes, wall posture, 40s, stand against the wall, 3 points touch, gentle chin tuck, slow 4-6 breathing. Circulation friendly sit, 40s, sit for coffee, breakfast, feet flat, knees 90 degree, calf pump, 10 flex point, plus 10 toe taps. Optional add 40s. Belly breathing to settle nerves and steady BP before the day gets busy. Why AM works: you wake with better neck alignment, steadier blood flow to the brain, and a calmer baseline for the day. B, midday, dekink and flow, 1 to 3 minutes, smart leg elevation, 40s. Feet on a low rest while reading, TV, or at the table. Run the calf pump. Posture. Reset, 40s. Restack spine and shoulders. Screen at eye level. Repeat calf pump if you sit long. Optional add 40s. Belly breathing, 3 out of 5 cycles. If stress is up or you've been seated for hours, why midday matters. It breaks up pooling in the lower legs, keeps energy from dipping, and reduces end-of-day heaviness. See bedtime wind down, protect the brain, 1 to 3 minutes, legs up the wall, 40s, 60s, gentle reversal of gravity, exit by rolling to your side, left side sleep setup, 40s, pillow between knees, neck aligned, shoulders relaxed. Optional add, 40s, belly breathing in bed, 3 to 5 cycles to nudge the nervous system into rest and digest. Why PM works, you offload the veins, ease the heart's workload, and set up calmer, more oxygen-steady sleep. Quick pairing tips. Make it automatic. Habit stacking. Tie each move to something you already do. Turning off the lamp. Left side, remote in hand. Leg elevation, coffee poured. Posture, reset. Tiny cues, sticky note on the nightstand. Left and rest. Small footrest by the favorite chair. Thin towel near the wall. Pace over perfection. If 40 seconds feels long, start with 20, 30s and build up. Consistency beats intensity. Safety and personalization. Keep it smart. If you have unexplained chest pain, new worsening shortness of breath, severe dizziness, or a history of unstable blood clots, pause and check with your clinician. For GERD, elevate the upper body for breathing and favor the left side at night. For neck, shuck, shoulder arthritis, keep the wall posture version gentle, head near, not forced against the wall. Closing, camera ready. You don't need perfect health or a gym membership to protect your circulation. You need small, steady choices, 40 seconds at a time. Pick one move to try today. Notice how your head feels clearer, your legs lighter, your breath easier. Then come back tomorrow and stack a second one. If this helped, subscribe and turn on the bell to stay with us here at Health Vita. Drop a 1 in the comments if you'll try a move tonight, or a 2 if you're building the morning routine. Your experiences help others in this community feel safer and stronger. On-screen end card. 6 40-second habits. Better flow, calmer nights. You've got this.